you guys. In this lesson, we are going to be talking about obstructive heart defects. In our obstructive heart defects, we have blood flow is being obstructed or blocked due to narrowing. And usually this narrowing is in a blood vessel or at a valve, and you end up with, usually the technical term is stenosis. So in the area before the stenosis, there's going to be an increase in pressure, and the area behind or after the stenosis is going to have a decreased amount of pressure. And this is really helpful because it helps us to think through what signs and symptoms we would be expecting when we talk about the different defects that cause this. The first one we're going to talk about is coarctation of the aorta. And this is when there is a narrowing of the descending aorta after the subclavian artery. And this is important because if it's happening after the subclavian artery, it means that there's going to be an increased amount of blood flow to the upper body and a decreased amount of blood flow to the lower body. And this pathology explains the classic symptoms that we see with coarctation of the aorta. And these classic symptoms are high blood pressure and bounding pulses in the upper extremities, low blood pressure or weak pulses or absent pulses in the lower extremities. In older kids, you can actually see other symptoms related to the high blood pressure in the upper extremities. Things like dizziness and nosebleeds may occur. And I have to say, this diagnosis is one of the most important reasons to make sure that you are always checking all peripheral pulses in kids and that you are comparing the upper and lower extremities. Many nurses have been the first to identify that a baby has weak or absent femoral pulses. So just know how important it is that you check those and you compare them. Okay, so the next obstructive defect is aortic stenosis. And this is where there's narrowing at the aortic valve. And the aortic valve is where the left ventricle meets the aorta. And this stenosis really affects cardiac output and causes it to be decreased. And it also is making that left side of the heart work extremely hard to get blood out into systemic circulation. And because of that, you end up with left ventricular hypertrophy. And also because that blood is having a difficult time leaving the left side of the heart, it's actually going to back up into the pulmonary system, causing pulmonary congestion. And all of that contributes to the symptoms that you see here. So they're going to have a murmur. And check out the med-surg lesson that we have on heart sounds and valve disorders. That's going to teach you how to identify the murmur that's specific to this diagnosis. But other symptoms they're going to have is they're going to show signs of having poor cardiac output. So they're going to have things like weak pulses, hypotension, tachycardia as the heart's trying to work and compensate. And then kids are also going to have difficulty feeding, which can lead to that weight loss and failure to thrive. The last obstructive defect that we're going to talk about is pulmonic stenosis, and this is when there's narrowing at the pulmonary valve. So thinking about the anatomy of the heart, this means that pressure is going to be increased on the right side of the heart and decreased on the left. So that right side is working extra hard, and you get right ventricular hypertrophy. And also with that right side working hard and blood's not able to flow through, you end up with systemic congestion, so blood's backflowing into the system. These patients are going to have a murmur, and if the stenosis is very severe, they may also be cyanotic and have difficulty feeding. Now, with that systemic congestion, you're going to get signs of edema, and you also could have signs of heart failure. So for our therapeutic management, one of the very first things that we can do is administer prostaglandin. We usually give this through an IV infusion, and what it does is it keeps that ductus arteriosus open. And when we do that, it helps improve oxygenated blood flow while the patient is waiting for catheterization or surgery. And this is usually done with patients who have coarctation of the aorta. And again, it's to help improve oxygenation. Other treatments for these obstructions are cardiac catheterization and surgery. With the catheterization, they may try either a balloon angioplasty or a valvuloplasty. And if surgery is required, they can perform a valve replacement or a resection in an artery to remove the stenosed area. Our nursing care for a peds patient after cardiac surgery is all about decreasing that cardiac workload so that the heart can heal and rest. So we really need to encourage these kids to rest, which is not always easy. We really want to make sure that they are not overworking with their feeds. And we also have to make sure we're managing pain and watching out for those complications that are common after these procedures like hemorrhage, stroke, or pneumothorax. Your priority nursing concepts for a peds patient with an obstructive congenital heart defect are perfusion, oxygenation, and gas exchange. All right, so let's do a quick recap of this lesson. We went over what obstruction means in the heart, and we talked about how most of the time that means there's a stenosis or a narrowing of some kind that's blocking blood flow. And most of the time this happens at a valve, and when it happens, when it's there, it causes changes in the pressures in the heart. So there's going to be an increase in pressure before the stricture or stenosis, and there's a decrease in pressure after. The first one we talked about is coarctation of the aorta, and this is where there's a narrowing in the aorta after the subclavian artery. And this just means that there's an increased pressure of blood in the upper extremities and decreased pressure in lower extremities, which gives us those classic symptoms of in the upper body we have bounding pulses and hypertension, and in the lower body we have weak pulses and hypotension. Definitely always make sure you're checking those peripheral pulses and comparing them. The major problem with aortic stenosis is that it severely affects cardiac output, decreasing it, and then increases the work for the left ventricle. And pulmonic stenosis causes a decrease in pulmonary blood flow, and it's increasing the work for the right side of the heart, which can cause systemic congestion and symptoms like edema. And all of these defects are going to require surgery or catheterization to help open up that stenosed area and restore normal blood flow. And that's it for our lesson on obstructive heart defects. Make sure you check out all of the resources attached to this, and remember the med-surg lessons on the cardiac heart sounds and the valve problems. All of those are going to be really excellent for you to listen to and combine with what we just talked about. Now go out and be your very best self today, and happy nursing.